If you want to squat deep with proper form, then this video is for you, so stick around. Hey, how's it going guys? It's Saman here from All Things PT, and in this video I'm going to show you what joints we need to work on so that you can squat deep safely with proper form. It kind of comes down to what joints are involved during a deep squat. First, it's going to be your ankle, which is probably the most important body part or the joint that a lot of people neglect. A lot of people are stiff in that joint. That's limiting their squat range of motion. Second, followed by your hip, which is just as important, followed by your back, and then the whole upper back actually, and your rotator cuff is just as important if you want to squat deep with proper form. So we'll start from some of the easiest fix to we'll get to more complicated stuff as the video begins. So this is going to be a long and detailed video, so make sure you grab a cup of coffee or notes, and then let's begin. We first need to fix one of the easiest thing to fix, and that is trying to find your optimal squat width or squat stance. I have heard a lot of people just randomly say start with your legs shoulder width apart, toes out a little bit, and then squat deep. So now that might work for some people, but for some people it's definitely not going to work, and that is quite dependent on your anatomy. So for a lot of people, you got to play around with your stance and kind of widen your leg, get a little bit of a wider stance, and then squat deep and see if that feels easier. So for me, I can't go past when I squat this deep. However, if I were to keep a little narrow stance, I can go very deep, and that actually feels comfortable for me overall. So first you got to find out what is your optimal squat stance and try playing around with it. Even if you are in a bottom position, try and see what feels more comfortable. And you probably won't be watching this video if you could go this deep already in the proper form. So what you could also do, you could experiment right here, and you don't have to have a full range of motion for that. You can just go a little bit, do a few squats with narrower stance, and see overall what feels comfortable to you overall, what allows you to go deeper. Even if you are not going all the way deep, just by changing that, see which stance gives you a better range of motion, and then you can slowly build up on that. Second thing you can do is get yourself a pair of change plates. You could this is a 2.5, but you could do it with a 5 or 10. You're going to put it on the ground, and with your heels you're going to step on it. Make sure it is as wide as it was before when you found your comfortable stance, and you are going to squat. Okay? If you found out that squatting with while stepping your heels on the change plate like this made your squat easier, then that means you lack ankle mobility. So then we will work on that. But until your ankle mobility improves, you can obviously step on a change plate like this so that you can squat a little deeper. What you could also do is get yourself a pair of lifting shoes. So this is specifically Olympic lifting shoes. It has a flat toes, the heels are slightly elevated, and so that's going to act almost like stepping on a change plate. So squatting on things like a running shoe or just your regular athletic shoe may not be the best. It's not going to be good for stability. These shoes right here is built for only one thing, and that is lifting. So squatting, deadlifting, Olympic lifting, stuff like that. So these are not the most comfortable shoes to wear in a party, but when it comes to squatting and working out, this provides a lot of stability. And just putting on a shoes like this, it's really going to help you improve your squat form. Now that you have found out that you have tight ankles, which is one of the reasons why you can't squat deep, it's time to really work on it. So you are going to kneel first, okay? And then what you will do, you're going to kind of be in this position. If that hurts, you can do it kind of on a bench or something. But you are just going to keep your heels on the ground and then let the knee rock back and forth. You should be feeling some stretch right here on the Achilles tendon. And all I want you to do is just rock like 10 times, okay? And then obviously do it on the other side. Just rock back and forth about 10, 15 times. Or you can just kind of hold for about 30 seconds to a minute, depending on how you feel. You can kind of try only like 15, 20 seconds, see how it feels. And once you are kind of there, especially if you are feeling a little bit looser, hold on to like a squat rack or a counter or whatever you can find. And what I would just do is I would hold on to something like this and just practice rocking back and forth. Okay? And that also will help. But until you feel like comfortable, you can actually just kind of swing like this, and that will help you kind of focus one side compared to the other. And just by doing that much, I actually feel a lot opened up on my ankle. Even if when I was squatting full, it was kind of tight. But now after I did it just for demonstration, it feels so much comfortable to go back down like this. And I don't feel any stress on my knee. I wouldn't say before my knee was hurting, but I would say I could feel a little stressed. But now, after doing that, there is absolutely no stress, and I feel perfectly balanced. Out of, I would say, good 6 to 7 out of 10 patients that can squat, this is going to be a big factor, a really big factor. It may not be the only factor, but it could definitely, it has been a big factor for a lot of my patients. The second one, a lot of time when you squat, you may feel a little pain in your hip, a little pinching on your hip. You may just round your back like this as you squat, because I see a lot of people kind of tilt their body like this as they squat. And it comes from poor ankle mobility, but also poor hip mobility. So we got to work on that. So there are a few things you can do. Let's work on some of the easiest one, no equipment needed type of things, and then we will make it a little difficult. So you're going to sit down on the ground. We're going to first start with stretching our groin. So don't worry, we'll get to some joint mobility stuff too. But this is a butterfly stretch. As you can see, I am a little tight on that right now. So you are just going to work on leaning side to side and just getting a little deep groin or a butterfly stretch first. That's number one. You don't have to do all the stretches or joint mobility that I showed today, but pick some that you feel that you need to improve the most. Pick the ones that you feel limited the most and work on it. So after we are done with some butterflies for about a minute or so, you're going to do a hip 90-90 where you're kind of dividing your leg or bending your knees like this, and then you are just being in that position and you are kind of rocking back and forth, okay? About 10 to 15 times. Just rock back and forth, and then you're going to switch sides on 10 to 15 times. Now, what I just noticed is when I did it the other way, my right side was a lot tighter. This side feels a lot freer. So I am going to spend a little bit more time doing it on this side. Okay, so after you're done, set her to 10-15 repetitions, then I would just rock like this. And then I'm going to especially now focus on opening my chest when I do this exercise. So as I switch position, I'm pushing my chest forward and looking up straight. So that opens up not just your hip, but also your upper back, okay? So just like that. Okay, now to know if it worked or not, you're going to retest it, and you are going to now see how deep can you squat. And even if you say you could only squat to 90 degrees, how does this feel, or this feel, or this feel now compared to the first time we did it? And honestly, just doing this much also made it feel a lot better for me. If you find that your hip, or especially the back, is super tight as you did your 90-90, you can be in this position either a little longer, or you can just completely modify it by doing what you call a pigeon stretch. Okay, so this is a modified pigeon stretch because I am a little tight on my butt as well. You can stretch it for 25-30 seconds, not a whole lot, and then switch and do this for 25-30 seconds. Okay, so one side may be tighter than the other, maybe spend a little bit more time or do an extra set. Okay, and then again, reassess. If you feel like any of these stretches that you did not help, then skip it. If it felt like it helped, make sure you put that into the routine. It's as simple as that, right? And for me, it felt a little better. If you're someone that felt a little pinching pain, then you can do this hip flexor stretch where you're seated. You are in this kneeling position, suck in your stomach, and then you are going to lean forward till you feel stretch right here. For a lot of people, this tends to help with the squat as well. Okay, same thing with the other one. Hold for 30 seconds to 45 seconds. Hold that position again. You don't need to do a super long. I would do repetition, especially if you are doing this pre-workout. If you're doing like a mobility day type of thing, which I definitely recommend for a lot of people, you can do it longer. And then again, we are reassessing. Okay. This one, for me personally, it didn't do much. So I don't really do that. I don't really spend a whole lot of time. But for a lot of people, that tends to help. Now for the next exercise, we're going to work on joint mobility. So this is not the best one. I have another one that's best. But for a lot of people, a lot of gyms, you don't have the big band, which I'm going to show you in a second. So this kind of works okay on a situation where you don't have equipment. Especially it's really worth trying. So what you're going to do, you're going to be in this half kneeling position. Your knee that is up, this one, needs to face the second toe. On this leg is the one that we're working, the one on the ground. And find yourself a comfortable position. You may not need weight on day one, but eventually as you get stronger, you will. What you are going to do, you're going to be in this position, you're going to rock forward, so this knee is going to follow the second toe right here. And then, as you come up, you're going to use the muscles of this leg, tighten this butt right here, and pull yourself back. Okay? You're not going to push with this leg. This leg is just for support. Now, if you're going to keep this butt squeezed at all times, you're going to go, don't let this butt go anywhere, keep it squeezed, and use this groin muscle to pull. So this also really opens up the hip. Feel free to experiment. If you're having knee pain, feel free to change the position of your foot. Either this one is comfortable, maybe this one is comfortable. Work with your anatomy and see what helps. Okay? Keep that squeezed, squeeze, squeeze, and up. Okay, so obviously need to do that with this leg too. So from a different angle for you guys. Same thing, squeeze this butt now. You should feel a stretch. Use this groin muscle, pull. Pull. Keep it squeeze, 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 pull. You can obviously add weight, so this is 2.5 pounds, but you can just do that. 4 to 5 repetition. Okay. So, retest again. Maybe not this deep, but how does it feel now? Can I go a little deeper? Maybe I could go here now, right? Maybe this feels more comfortable. Maybe just by working on those, I'm not rounding my back as much. See what works for you and then go from there. Again, if this did not do anything, that's fine. Just don't do it. Do the ones that works for you. Okay, now, if you have a band like this, then the next stretch that I am going to show you is the best stretch, but a lot of people don't have that band. So if you want, investing on a band like this is actually really good if you have had a history of hip pain. So you're going to tie it somewhere, wherever. I'm just going to do this side for demonstration purposes. You are going to put it somewhere lower, okay? As when you're in the ground, the band should be lower than your hip. You don't have to be so very, very specific, but the band, the direction of pull, needs to be lower than your hip. And then you're going to go walk on your side like this, and then you are going to sit down. Okay, so it's the same position, right, that we were kind of in. However, is now, because all the tension is on the hip above, this is the hip that you are really working on. And all you will do with this one is you are just going to go in and out like that. Keep this butt squeezed now, even on the way in or out, and just try to let it pull. You can also, after every rep on this, try to relax this hip, and then you're going to find like there is a gentle distraction type of force on this hip, and that's what you want. So you can also kind of experiment and use this arm to pull this hip like this. You can always hold on to something for balance, and then relax and see if you feel a stretch like this, and just stay there for 30 seconds. Or my favorite, go in and out. You can squeeze your butt in and out. Okay. And then after each rep, relax. So that's also really helps to open up the hip. But like I said, the only thing is a lot of places don't have this band as thick as this. But if you have somebody with a hip issue, then you can definitely work on getting one of those. It's definitely worth the investment. Again, okay, see if that helped, if that didn't do anything. How does it feel now? I'm definitely feeling a lot limber. What I would do several times at home is I would just sit in my squat rack, squeeze the shoulder blade together, and I would just learn to rock back and forth. Just feel the stretch in your hip, in your ankle, in your upper back. Say you can't go that deep. Now, just assume for a minute, hallucinate with me here, that this is a step, and I would sit on that. And so if this is the max I can go, I would just sit on a step, and I would just kind of rock back and forth, look myself in the mirror if that's available, record myself, then analyze later. And I would just kind of rock like this, be in that position for 2-3 minutes. and then just kind of build up my tolerance, okay? The final one, for a lot of people, for a lot of them, as you squat down, your upper back tends to collapse like this. So they're like this form, and that messes up your squat form as well, because then your entire back is going to be rounded. And this, how are you going to squat this? Like this, right? So a lot of people will compensate, and they can't squat because they don't want to do this. So they can squat. So then what it comes down to is improving your upper back mobility. And so you can do your foam roller, at least at the beginning. So I'm going to get myself a, okay, and this is not going to be a permanent fix, for sure, but what this is going to help is it'll help you be in a deeper squat, in a better posture temporarily, and then you work on your range of motion, and eventually with practice it's going to improve. So what I recommend is being on the same position like you're about to squat, so like this, and find a spot that's tight. So this spot, if I were to roll right here, for me, it's useless because I don't feel anything. But as I go lower, I feel a little tightness on that level, right between my shoulder blade. So I tend to spend a little more time right there in this position, okay? And the thing about the upper back is that they can be very, very stubborn, okay? They can be pretty stubborn. And so you have to spend a little time, a little effort right here. The next thing, what I would do after about 20, 30 seconds, is I would just tighten my core right here, and I would just go back and forth. I can alternate, just depending on what feels good, or I can just go back and forth and be at that spot. If it hurts too much, just be in this position that's comfortable. Just say only I can go maybe this much, that's fine. I can go this much, that's fine. I can go this much. Okay, this is starting to hurt, so I just back off. Okay? So first I start with that, and that only takes about a minute, tops. Then, if I can go, I will go on the deep squat position, and I will just work on opening my hip like this, and I felt a good pop right there. Just open, open, open. Okay, say you couldn't be in this position to open yourself upper back up. Then, what I would start with is going on my hands and knee. I will start with my arm, right like this. Try to make sure that I am in a good position and I'm not rounding my back. And what I would do is I would put my arm behind my head. With this elbow, I try to reach my thumb as much as I can without bending this left elbow, and I try to open. Okay? Open. You don't have to diligently kind of strain yourself trying to reach with the right elbow, reach the thumb, but just do what you can and try to look to the direction wherever your elbow is. So turn your head as you go. So if I were to show you from this side, right here, my arm right here, go on force, make sure I'm trying my best to be in a good form, tabletop, and I can feel that this side is tight. So maybe I do an extra set. If this is easy for you, then what you can do is now you can put your hand behind your back like this, and then suck in your stomach. Now, this is my right hand right here. I have bent. I'm going to turn or supinate my left. I'm going to go in between my knees as close to the knees as possible. And then I'm going to do the same thing, and then I'm going to look. Okay? I'm going to twist. Then let's show you from this angle. So I'm like this, and twist. And twist. And twist. Twist, okay? So 10 to 15 repetitions. I can already feel my upper back open up so much. And now mind you, I was already able to do a full squat before I did any kind of warm-up. So now, compared to my first time I did it today, just for this video, it feels so much better, 100 times. There is absolutely no stress anywhere at all. And I could just sit here freely compared to before. Okay? The last one is, I have this band right here. And what I'm going to do, I'm going to squeeze my shoulder blades first, okay? And I'm going to hold my band like this. And I'm going to pull this band out, hold for a few seconds, relax. Out, hold for a few seconds, relax. Pull out, hold for a few seconds, and relax. If you can do this just fine, then I'm going to tie the band like this around shoulder level. I'm going to grab it like this. Okay, I'm going to grab it like this. I'm going to pull the band, squeeze my shoulder blade together, pull up, hold. Just do whatever you can. Same thing. Okay. 5 to 10 repetitions. Make it as difficult or as easy as you can tolerate. And slowly build up, because then this pull like this is the same position like you would be on a squat, right? Sorry, before I forget, the reason why we are doing this one exercise we just did is when you don't have a proper shoulder range of motion, you will have a hard time keeping your elbow like this. And what ends up happening is your elbow is going to flare up like this, okay? And as you squat, you are going to squat down with your back bent. And that will put a lot of pressure on your back. That is going to, and then you won't be able to squat very deep. So having enough mobility on your rotator cuff, having enough strength and mobility on your rotator cuff, I should say, will allow you to tuck your elbows right by the spine and keep it there. That way you can lock your lats, and then you can squat deep. Okay? Again, even if I were to fully collapse like this, you can see that my form hasn't really broken down. Okay? So try all that, but most importantly that nobody talks about is you got to be patient and just work on your form. Get yourself some squat shoes, step on the plate, see what helps, and then eventually do it again and again and again. I promise it's going to be better, okay? Hopefully this video helps, and it's a long video. If it did, please make sure you click the like button. Please follow me. Please subscribe to my channel. Until then, take care. Bye-bye.